You may have seen this device around the warehouse, but you might not be completely familiar with what it does, or how to use it. This is an AED, an automated electronic defibrillator. It's a machine used when an individual goes into sudden cardiac arrest. Sudden cardiac arrest is when normal heart function stops quickly and without warning. It can occur at any time, at any place, at any age, and without any warning. This means that the heart is no longer pumping blood to the rest of your body and vital organs. However, unlike a heart attack, sudden cardiac arrest is an electrical problem, which creates an abnormal heart rhythm. That's where the AED comes in. The shock from an AED is used to correct abnormal electrical disturbances, causing irregular heart rhythm, which reestablishes normal heart function. The AED is programmed to recognize and shock two types of abnormal heart rhythms: ventricular fibrillation, VF, and pulseless ventricular tachycardia, pulseless VT. Because of this programming, the AED will not shock someone who has a normally beating heart, so don't be afraid to use it. And the Good Samaritan laws protect individuals using an AED from liability, so you can only help, not hurt, by using this life-saving device. In fact, there is one instance of sudden cardiac arrest every 12 minutes in Canada. And unassisted episodes of sudden cardiac arrest account for approximately 15% of workplace fatalities. So let's walk through this device step by step. So if an incident does happen, we will all be prepared to help out in the event of an emergency. First, keep in mind that most AEDs have clear voice and visual instructions, walking you through each step of the process. This allows anyone to use the device, regardless of training, age, or experience. If possible, have someone trained in CPR begin chest compressions. This will keep the heart muscles activated while you prepare the AED. Step number 1. Turn on the AED. The voice and/or visual prompts will begin. Step number 2. Call 911. While it is good that professional help is on the way, time is of the essence. The probability of survival with sudden cardiac arrest declines by 7 to 10% with each passing minute. So let's get going and set up the AED. Step number 3. Attach the cables to the electrode pads. Keep in mind that many AEDs will have these cables pre-attached, so you may be able to skip this step. Step number 4. Expose the chest and make sure it is dry. These pads will apply best to a smooth, dry surface. If the chest is very hairy, and you have the necessary equipment, such as a razor, shave it. If there is an undergarment, such as a bra, remove it. Both the strap and the band are in the way of correct pad placement, and an underwire could present an arc burn risk. Modesty doesn't much matter in a life or death situation. If there are medical patches, such as nicotine patches, remove them. Step number 5. Peel away the protective plastic from the pads and attach them. One pad goes on the upper right side of the chest, just below the collarbone. The other goes on the left side of the chest, just below the armpit. Most AED devices, or electrode pads, have handy diagrams to help you figure out the proper placement. Step number 6. Stand back and make sure that no one is touching the person receiving the shock. Step number 7. Press the Analyze button on the AED and follow the voice prompts. Some machines may automatically begin analyzing once the pads are placed. Step number 8. Once the machine has completed its analysis, it will clearly indicate whether a shock is or is not required. Step number 9. If a shock is required, push the flashing shock button. Keep in mind, some AEDs will automatically apply the shock if it is required. Step number 10. If the individual is responsive, move them into the recovery position and leave the AED attached. If they are not responsive, continue chest compressions and follow the instructions from the AED until help arrives. Step number 11. When first responders arrive, they will require a report from the operator of the AED, indicating what happened, what steps were taken, and what symptoms were witnessed. This report is considered part of a patient's medical history and should be treated as confidential at all times. Some common questions are: what about children? An AED is perfectly safe to use on a child who is more than 1 year old. If there are pediatric electrode pads and a pediatric shock setting available, use those. If not, you may use the regular pads and regular settings. Just ensure that one pad is placed on the child's chest and the other is placed on their back so they do not touch. What about women who are pregnant? Can you use an AED on a pregnant woman? You bet. There is no risk to the fetus during regular chest compressions or the shock from the AED. Just be sure that once the woman is in recovery, you move her to lie on her left side, as this increases blood flow to the heart and the fetus. Having the confidence to respond to a sudden cardiac arrest with an AED can mean the difference between life and death. If you have any further questions or concerns, please speak with one of your local branch health and safety representatives. And remember, stay safe out there.